All right, in moments, a world-renowned cardiologist from the UK, I'm so excited about this segment, is calling for a pause to the COVID vax program. So he's here next with the chilling reasons as to why that is. So stay with us.
Having been double jabbed and being one of the first to take the Pfizer vaccine, I have, after several months, critically appraising the data, reluctantly concluded that this vaccine is not completely safe and has unprecedented harms, which leads me to conclude that it needs to be suspended until all the raw data has been released.
That was famed UK cardiologist, and my next guest, Dr. Aseem Malhotra. He says that after he posted this on social media, he was suspended by Facebook for 3 days for, quote, not following community standards. Well, Dr. Malhotra, president of the Public Health Collaboration, joins me now. Doctor, thanks for joining us tonight. Now, you started looking into this after your father, who's a healthy man in his 70s, received his vaccine. Tell us what happened.
Good evening, Laura. Thank you for having me. So I originally, interestingly, was one of the first to have 2 doses of the vaccine, and even went on Good Morning Britain to help tackle vaccine hesitancy, because although I've been very suspicious, as many people have been, about the pharmaceutical industry-sponsored research for many years and the reliability of it, I never conceived of the possibility, Laura, that a vaccine could do harm, and certainly not harm to the heart. And then in July of last year, my father, who was very fit and active and well, I'd actually carried out some routine heart checks on him a few years earlier. Everything was good. He suffered an unexplained sudden cardiac arrest at home. And his post-mortem findings didn't at the time make any sense to me. He had very severe narrowings of the coronary arteries, what we call critical stenoses. And then several months later, lots of different data started to emerge, which essentially, to summarize, suggested that the mRNA vaccines, Pfizer, Moderna, for example, likely accelerates coronary artery disease. So I then decided to do my own critical appraisal of the data and spent several months looking at it myself, speaking to eminent scientists in various universities, Oxford, Stanford, Harvard, experts in immunology. 2 Pfizer whistleblowers spoke to me as well, and I spoke to 2 investigative journalists. And then I decided I was going to publish my findings in a medical journal, which went through peer review. And essentially the conclusions are this, Laura, that unfortunately this particular vaccine has harms that are unprecedented. The efficacy is actually very, very poor, and I can break that down for you in a second. But what the conclusions are, very clear, overwhelming, unequivocal evidence that these vaccines need to be suspended, paused, pending an inquiry.
Now, a new study, Dr. Malhotra, by folks at Kaiser Permanente revealed that 1 in 7,000 boys in the U.S., ages 12 to 15, develop myocarditis after receiving the Pfizer vaccine. Meanwhile, the FDA just approved boosters for children as early as age 5 to 11. Is the myocarditis, just something that's, it's a side effect? Every drug has a side effect? Or does that number disturb you?
Let me just break it down in a more general terms. So when I looked at this data, what we find in absolute risk of harm in general, when it's about serious adverse events, so this includes things like myocarditis, but anything that causes disability, hospitalization, these includes heart attacks and strokes, for example, that is at least 1 in 800. And that data, interestingly, comes from Pfizer's own trial and Moderna's own trial. This was published in the journal Vaccine a few weeks ago. Eminent scientists were able to reanalyze some of the original trial data. And what they concluded, Laura, which is extraordinary, is that in the trial, one was more likely to suffer a serious adverse event from the vaccine than one was to be hospitalized with COVID. What that suggests that the original rollout, what led to the approval by the regulator, that data suggested at the time it was likely to cause more harm than good in most people. And that's a smoking gun. That's more than enough evidence for us to pause and stop the vaccine rollout. So myocarditis is one issue. The other very good, clear data actually reveals that in people aged between 16 and 39, Israel data showed this, there was a 25% absolute increase in heart attacks and cardiac arrest, which was associated with the vaccine, but not associated with COVID. This has now been replicated in Florida, a similar type of findings recently, and that's why the general surgeon of Florida has come out and suggested that certainly people in that age group shouldn't be having the vaccine. But I've looked at that data, I've spoken to the researchers in Israel, and in fact, this signal of harm is for everybody, even people over the age of 60, not to that degree.
Well, doctor, let me jump in here and just very quickly. Given what we know thus far, was this vaccine rolled out too quickly without adequate testing because of the global pandemic nature of things?
I think yes, but Laura, I find it very difficult to believe that Pfizer senior executives and Pfizer scientists didn't know when it was being rolled out, because they have access to the raw data, which we now know shows significant harm. It's likely they knew this, which means that I don't think it probably, with hindsight, and I'm sure an investigation will reveal this eventually, it probably should never have been rolled out in the first place.
Wow. If this is the case, this is a global scandal. We've been covering this from almost day one. A global scandal.
Yeah.
I mean, it's as big as it gets.
No, it is. I think, Laura, we are, this is perhaps the greatest miscarriage of medical science, attack on democracy, damage to population health, an erosion of trust in medicine that we will witness in our lifetime. I'm speaking in the British Parliament on Thursday on this to members of the British Parliament to present this data. They need to act now and stop this from continuing to cause more harm. The longer it goes on, the more damage is going to be done, the longer it's going to take to regain trust.
Dr. Malhotra, this was just invaluable. We really appreciate your courage and speaking out and your expertise that was devoted to this subject. A lot of people wouldn't do this. You did. Thank you very much.
Thank you, Laura.